Okay, ma'am, I'm ready.
So if you've read and understood, considering its surgical pathology station, please tell me what would be your provisional diagnosis after you've read the stem.
Pleomorphic adenoma.
All right, please define the term pleomorphism.
Pleomorphism is remarkable diversity in histology.
Okay. All right. Can you please give examples?
Like pleomorphic
Insights.
adenoma, which here there is ductal histological changes in the ductal system, which are the epithelial
Okay.
and the myoepithelial system,
Right.
which reflects it to be having both epithelial and mesenchymal
Right.
changes.
Can you define the term dysplasia?
Dysplasia is the different forms of tissue, different
Okay.
forms of cells in histological findings.
Okay, please, if you could describe one pleomorphic adenoma, how it would appear. If you
Uh,
are asked to describe it, how would you describe it? Just have a look. This is the histological sample. Would you be able to explain this?
yes, this is hemotoxylin and eosin stain
Yes,
under
showing.
microscope showing purple color uh, uh, around the
What
pink,
are
and
these?
these are I
These are
think
the ductal
ductal system, and
epithelial
then
cells. So these are adipocytes. And what are these? This is also
these
duct. What are these? Would you be able to comment?
I don't
Would
know.
you be able to recognize myoepithelial cells in this or
Yes,
any?
these purple ones are my epithelial
Right,
cells.
good. Okay. All right. If you'll read this stem and tell me if this patient was suffering from a malignancy, how would or what would be the signs and symptoms or the clinical signs you will pick?
Okay, patient, if it was malignant, would have facial nerve involvement,
Right.
or or there would be invasion of, and the rate of growth would be more rapid. There would
Very
be
good.
invasion of underlying structures.
Very
There
good.
would be skin involvement and skin ulcers and the nodal involvement as well.
Okay, so when you say so, there is always invasion of the overlying skin, and when it affects the underlying structures, then it causes fixity to the underlying structures. Here, the mass is mobile, so it's not, most likely it's not malignant right now. Okay, please tell me how would you, or what are the types of parotid tumors that you are aware of?
There are benign tumors and then there are malignant ones.
Yes, please.
85% of them are benign, such as pleomorphic adenoma, Warthin tumor, oncocytomas, basal cell adenomas, and canalicular adenomas, and then there are ductal papillomas. These are all benign. In the malignant ones, there are mucoepidermoid carcinomas, adenocarcinomas, and acinic cell carcinomas, or adenoid cystic carcinomas, and squamous cell carcinomas.
Okay, so if this patient came into your outdoor, what investigations can you perform on this patient at that particular moment?
We can do FNAC, fine needle aspiration cytology.
Anything else?
Uh, we can
In,
do clinical examination or
right.
FNAC, or we
And
can also go for true cut.
no, you can also do ultrasound,
Okay, yes.
right? It's all right. Okay. Just pause. Yes, right. If you'll, once you'll take the FNAC, or instead of using this abbreviation, please use the fine needle aspiration
Okay, ma'am.
cytology. Right. Okay. What are the features you'll look for if the cell is malignant under the microscope?
There are many features like there is breach of the normal tissue boundary.
Okay.
The malignant cells go beyond the tissue boundaries,
Yes.
and there is increased nuclear to cytoplasmic ratio.
Right.
There is pleomorphism. That means the cells are arranged haphazardly and bizarre. They
Yes.
with different large and small sizes of nucleus and cytoplasm. There could be hyperchromatism. That means there the nuclei would be more prominent and darkened,
Good.
and there could also be anaplasia. There would be more less differentiation or poor differentiation
Good.
or absence of the differentiation.
Right.
And there could also be goblet cell formation when the small malignant cell coalesce into a large one.
Right. Good. Please tell me, how would you define or how would you differentiate between cytology and histology?
Cytology is basically the study of the cellular function and structure, and histology is the study of the tissue under microscope.
Okay. Right. Good. Please tell me, if you could define the terms high specificity test and high sensitivity test.
Sensitivity means that the test that confirms the true positive diseased patient. And if we do the population test, that means there are less false negative. And specificity is high specificity is when we do the test that confirms that the patient does not have the disease. That means if we do the test population, that means the high specificity means that there are uh, less false positive.
Good. Please tell me, while you decided to take fine needle aspiration cytology of this particular patient, somehow your assistant got needle injury. What would you do at that moment?
First of all, I would run the injury, the hand or the where there is injury, wash it under running water with soap,
Yes.
and then cover it with impermeable dressing.
Yes.
Then I would assess the incident risk and assess the patient source. I would document the incident and also talk to the occupational health for any advice, and also document the incident. And in the incident risk, I would try to find if the patient, in the incident risk, I will see if the injury was deep or superficial, if the sharp was used intravascular or subcutaneous or for suturing, if the sharp has blood on it or there's no blood, and age of the sharp, if it was recently used or if it was old. And in patient risk, I will check if the patient has any blood-borne disease, and the status of that, if it is totally cured, if patient has undergone treatment, or if it is aggressive, and if the patient does not know about the disease, then I will give the treatment or take the prophylactic post exposure prophylaxis according to all this.
Good. Please identify this arrow structure. What do you see? What kind of image is this, and
This
what
is
are you
a
looking
CT,
at?
this is a CT scan head and
Okay.
face showing a hypodense lesion uh, at the this left pre-auricular area, which
Yes.
most probably could be a pleomorphic adenoma.
Okay. Why it cannot be Warthin's tumor?
It can also be one.
Yes, one of the benign. Right. Good. Thank you.
Thank you.